You're listening to Clinicians Roundtable on ReachMD. On this episode, Dr. Sayna Norouzi will discuss patient-centered communication strategies for IgA nephropathy. Dr. Norouzi is an associate professor of medicine and clinical nephrologist at Loma Linda University Medical Center in California. She's also the founder and director of the Glomerular Diseases Clinic at Loma Linda and serves as the director of the GlomCon Glomerular Diseases Fellowship Program. Let's hear from her now.
I think one of the main barriers that we have for our patients is that these patients are really young. They're not patients that are coming in and say that I'm not able to work anymore. They might have some fatigue. They might have some symptoms of sometimes some edema, depending on the degree of CKD, of course, as well. But majority of patients, when they show up, they are in their 20s, 30s, and even 40s, and they're still young and they go to work, they are raising a family, and they do not want to be sick. They don't want to take multiple medications. So I think it's truly an art to talk to these patients and discuss the prognostic values that we have for them. I actually have this radar study data in my clinic that I actually show them the data and say that, look at this, these are the years that you have, and in 10 years or in 15 years, you might end up on dialysis because you are in the category of patients with this much of proteinuria, and this is your kidney function at the time. So I try to explain it in simple words as much as possible. But I can tell you, with having access to ChatGPT and internet these days, a lot of my patients, when they come in, they know a lot already about their disease, and they know even about the newer options that is out there, and they just want to know which option is going to be the best for them. Going home with multiple medications, it's not happy news for them, but I always tell them that, you have a lot of options. 6 years ago in my clinic, when my patients were coming in, we did not have any of these options. And even though that we knew that these patients might end up on dialysis or transplant, we couldn't do much. And we weren't optimistic about the possible outcomes. I know that you're taking multiple medications and you have to be careful about the possible side effects. But the good part is there is possible treatment for you that can delay complications for you. We have a good understanding of their safety data so far, and you have access to these new medications as well. And I try to explain to them that even for the safety data, I understand that we need longer term data on that. But so far from the clinical trials, most of these medications, they have a really good safety profile as well. Comparing, for example, to systemic corticosteroids that we used it historically for patients with IgA nephropathy, high-risk IgA nephropathy. So I think that the kind of conversation and how you establish that relationship with your patients, it's really important. And actually, it really helps them to be more compliant with their medications, being more compliant with their follow-up visits. And maybe it's not that hard to tell them that we have the same goal and we want to prevent complications for you. And these are your options, and let's work together and see if we can put you in remission.
That was Dr. Sayna Norouzi explaining how to counsel patients with IgA nephropathy on treatment options and long-term outcomes. To access this and other episodes in our series, visit Clinicians Roundtable on ReachMD.com, where you can be part of the knowledge. Thanks for listening.